Hi, my name is Sarah and I'm one of the nurse practitioners here at Stanford Sleep Surgery. My job is to make sure that you get the best possible care, particularly after your MMA surgery. First, we're going to go over some commonly asked questions about the MMA surgery and what to expect.
Time. You will receive a phone call the evening before your surgery with a finalized surgery time. You will not be notified any sooner. Diet. Do not eat or drink anything starting 12 a.m. prior to surgery unless you have been told otherwise. Failure to comply will result in rescheduling of your surgery. Transport. A known friend or family member is required to drive you to and from surgery. Non-medical transport services such as Uber and Lyft are not allowed. Length of surgery is as long as it takes for the best surgical outcome. Average time in the OR is 3.5 hours. Length of hospital stay. Admission to Stanford Hospital is typically 2 nights. In some cases, we may monitor you for 3 nights. Cases of severe sleep apnea may spend the first night in the intensive care unit for closer monitoring. Imaging. A CT scan will be done after surgery to check for bony alignment and hardware positioning.
All right, now here's the important part. We are going to talk about how to take care of yourself after MMA surgery. The important thing to remember is that all of these things we ask you to do have the common theme of good oral hygiene. If you have good oral hygiene, that results in good healing. If you heal well, that is the result of a good and successful surgery.
First, when are your visits after surgery? They will be during weeks 1, 2, and 4 after your surgery, and they will all be scheduled before your day of surgery. During the first visit, which is 1 week after surgery, we will do an oral wound irrigation where we clean out your mouth, and we will also debride or clean out any of the crusts and post-operative debris that might be in your nose. During visit 2, which is 2 weeks after surgery, we will again wash out the mouth, clean out the nose if there is any crust, and we will rearrange any rubber bands inside your mouth if necessary. During visit 3, which is 4 weeks after surgery, we will again look inside your mouth and rearrange any bands if necessary. Post-operative visits 4 and on will be scheduled as needed as decided by the clinician.
There are several important categories that we are going to go through.
Categories of care after MMA surgery include pain management, diet, oral care and hygiene, nasal care, facial sensation training, activity restrictions, and time off. Now let's take a little time to go through each of these. Pain management. As long as you don't have any drug allergies to the following pain medications, they will be prescribed to you at your pre-op visit to the pharmacy of your choice. We will be prescribing you 3 pain medications. First, liquid ibuprofen. Take this every 6 hours after surgery once you get home. This medication is the most effective in managing your post-op MMA pain and facial swelling. We will also be prescribing Hyset, which is a liquid form of hydrocodone, a narcotic, and Tylenol, also known as acetaminophen. Take this every 6 hours in combination with the liquid ibuprofen. If you desire, you can also stagger their use. Keep in mind, there's a maximum daily dose of 4 grams of Tylenol per day, so if you are taking additional Tylenol, please take into account that it's already inside of the Hyset. Finally, you will be prescribed oxycodone tablets. This is for breakthrough pain. You can take it every 6 hours for severe pain only as needed. You can crush this tablet and take it with a juice or liquid of your choice. Some tips on pain management. Remember to stay on top of pain instead of chasing pain. This means for the first few days after surgery, when you get home, it's probably a good idea to take your pain medication very regularly as prescribed. It would not be a good idea to tough it out and end up in a pain crisis that is difficult to control. As pain decreases, medication intake can decrease as well. For example, instead of taking the high set and the ibuprofen every 6 hours, you can transition to taking the ibuprofen every 6 hours and maybe taking the high set every 8 hours or even more infrequently. Eventually, sometime during the first week or the second week, you should be fine on just taking the liquid ibuprofen, which is most effective in managing your pain. Because narcotic pain medications, such as the high set and the oxycodone, can cause nausea and constipation, we will prescribe an anti-nausea medication, liquid Zofran, and an anti-constipation medication, liquid Senicide, to be used only as needed. Now, let's discuss diet. A syringe with a soft rubber tip will be provided to you for your liquid diet for the first 2 weeks. An important thing to keep in mind is that you cannot progress on in your diet without our approval at your post-operative appointments. We have to physically look inside your mouth to make sure that you are healing properly in order to move on to the next level or texture of food. To fail to do so can result in delayed healing, increased risk of infection, and other post-operative complications. Refrain from using a straw for the first 2 weeks. Your cheeks and chin may be quite numb, so it's helpful to eat food in front of a mirror. This also teaches and retrains sensation to your nerves in the face. The chart below is an estimated timeline of how your diet will progress. Your progression may vary depending on how you heal. Keep in mind, again, you cannot progress on to the next level of food until we actually physically look inside your mouth and tell you that it's okay. A predicted schedule will be first week, clear liquid diet only. This is exactly what it sounds like. It must be clear, meaning that you can see through it, and it must be liquid. There can be no fiber or any particulate or powder or any pulp in the liquid. Examples of this are very limited, including water, apple juice, cranberry juice, and different types of broth such as chicken and beef, and even those may need to be strained to some degree. Week 2, you may progress onto a full liquid diet. This means that it is still liquid, but it does not have to be clear, it can be opaque. Things such as soup without any particle or debris that is well blended, milkshakes that have no particulate in them or any tiny strawberry seeds, and finally, protein shakes that are very well blended. Week 3 would be a puree diet. This includes things such as mashed potatoes and very soft items like porridge. Weeks 4 to week 6 would be a soft diet. This includes things like scrambled eggs, macaroni and cheese, and pasta that is overcooked. After week 6, if you have healed properly, you can gradually move on to all different types of food. Next, oral care and hygiene. First of all, we will be prescribing clindamycin, which is a liquid antibiotic. You will be taking this for 10 days after you get home from surgery. If you have more than 5 to 6 episodes of clear liquid stool within 24 hours, please stop taking the medication and let our clinic know, as you may have gotten antibiotic-induced diarrhea. If you have an allergy to clindamycin, our clinic will make a point to prescribe a different antibiotic to you. The point of this medication is not to treat, but to prevent infection from setting in. We will also be prescribing an oral rinse called Peridex or chlorhexidine. This will be prescribed to your pharmacy with one refill, and we ask that once you get home, you swish it around in your mouth and you spit it out twice a day for 2 weeks after surgery. Brushing teeth. We recommend that you purchase a small, soft baby toothbrush. It's okay to use regular toothpaste, and brush your teeth twice a day, every day, starting from day 1 after you get home from surgery. Make sure you reach far back into the mouth, cleaning gently along the gums to remove food debris and plaque. Do not use a water pick or an electric toothbrush for the first 4 weeks. Brushing your teeth regularly after surgery is of utmost importance and is one of the best things that you can do to prevent infection from setting in and helping the incision sites of the surgery to heal well. Keep in mind, you can always breathe through your nose and through your mouth. Only in a state of severe anxiety or emergency do we want to remind you that you, if needed, can cut or remove the rubber bands that are keeping your mouth in position. Otherwise, we do not recommend it, as the rubber bands are there so that your bite will remain correct. Here are some examples of what we want you to buy: a baby toothbrush, regular toothpaste, and the prescription oral mouthwash. Next, let's move on to nasal care. Because the MMA surgery involves a septoplasty or a straightening of the septum, there is an aspect of taking care of your nose. Nasal care begins even when you are still in the hospital. We will show you how to irrigate your nose. After surgery, there will be expected debris, blood, and crust inside the nose, and this will make nasal breathing difficult for the first week or 2. To promote good healing and to soften the crust, we recommend that you rinse your nose with this sinus rinse bottle twice a day at least. We will give you a separate education sheet on exactly how to do it, in addition to educating you at the hospital. You can buy the NeilMed Sinus Rinse bottle at your local CVS or any drugstore. We highly recommend that you only use distilled water or water that you have boiled and let cool completely. We do not recommend using tap water or watered bottle or any other kind of water. Keep in mind, this is not necessarily going to help you breathe through your nose better, but it will help with healing, and it will make it more pleasant for you when we clean out your nose during that first post-op visit. We promise that you will be able to breathe through your nose very well after that first post-op visit. Keep in mind, at the hospital they may give you something called Afrin nasal spray, which is a strong decongestant. We do not recommend using that unless you have a very obvious nosebleed. This does not include normal post-operative debris and drip that might be coming from your nose that looks a little bloody and crusty. Next, let's talk about facial sensation training. After surgery, you will notice that you have decreased sensation and numbness in the lower half of your face. In time, much of this will return. After surgery, we recommend sitting in front of a mirror and moving a tongue depressor or even your finger in strokes up and down across areas of your face. Do this several times a day. As you do this, actively think of which way the strokes are moving across your face. This will help retrain sensation. Physical activity. Surgery will not impact your ability to walk and be mobile. In fact, we encourage you to take walks after surgery and continue taking active walks after going home. This will also decrease risk of developing blood clots in the veins of the legs. Avoid heavy lifting, including things that are 20 pounds or heavier, which is roughly 2 light grocery bags, for about 3 weeks after surgery. You can expect to start and build up to regular physical exercise around weeks 4 to 6, depending on your individual progression. Refrain from activities with risk of jaw fracture, such as rock climbing, boxing, or cycling. Our best advice to you is to start slow and listen to your body. Next, time off. Depending on your job or place in school, please expect to take 3 to 4 full weeks off. Jobs that require a lot of talking might be more limited than jobs that can be done at home from a computer. We recommend that you focus on healing for the first 2 weeks and avoid any stress to your body. If you have the luxury of working from home, you could probably start to work from home part-time at around week 3.
Now let's talk a little bit about risks of surgery.
Risks of surgery can include things such as jaw fracture, malocclusion or your bite not being aligned, jaw joint clicking or pain, long-term numbness of the nerves supplying sensation to your face, mouth, and tongue, nasal obstruction, or feeling that your facial changes are unfavorable. Keep in mind, we always like to remind our patients that sensation of the face typically returns with time. However, the chin, in and of itself, may or may not recover in sensation.
All right, we've gone through everything, and you should be quite well prepared to take care of yourself after MMA surgery. If you have any questions or concerns, you can refer to the MMA handout that we've provided. It goes through everything we talked about here, and always feel free to contact our offices or use the MyHealth app to message us.